111. And the conference ID is 392-429-561#. This meeting is being recorded, and we would like to remind everyone who speaks to state your name and the organization you represent before starting your comments. If you are not representing an organization, you can just state that you are representing yourself. We want to remind everyone to turn their camera off and to mute their microphone unless speaking. To begin, we will take the roll call to ensure we have a quorum. We've been notified that Dr. Jager unfortunately will not be able to attend. So I will continue with, is Dr. Vijay Sikhan present? Jeremy Mangum?
Present.
Rowena Copeland?
Present.
Lucy Gesundheit?
Present.
Afton Heinzen?
Present.
Thank you. We have 4 out of 6 members. So we have a quorum. I will pass it on to Mr. Magnum, and the meeting is yours.
I have never done this before, Matt. Thank you. To be honest with you, I don't even have a script. Dr. Yeager just asked me to do this, and I saw the email about 15 minutes ago. So
Okay.
I'm not sure what to do.
Jerry,
in this position to lead the chair. So
hello, Jerry. This is Bill Gorman. You
Hello.
received a copy of the agenda.
yeah, let me pull that up.
If you just
Let me
follow and go through the agenda, you'll be fine.
Okay, give me a minute here.
If it's helpful, Jeremy, it was sent on October 3rd.
What's that?
I said if it's helpful, it
Yeah.
was emailed on October 3rd.
I've got the agenda right here. Well,
Okay.
let's see.
September 3rd, right?
Sorry, thank you, Matt.
You're welcome. Thanks for helping. Appreciate it. It's my first time running the meeting.
Yeah, I've got the email right here. Okay. Right, I am pulling it up on my big computer, so I have to look at it from my phone. All right, so Matt, you've already done the call to order. Roll call.
Yes.
Perfect. Okay, so our agenda, Thursday, September 19th, 2024, 12:30 p.m. meeting. Item number 1, call to order, has been completed by Matt. Number 2, public comment. I'll read what it states here. No action may be taken on a matter raised under this item of the agenda until the matter itself has been included specifically on the agenda as an item upon which action will be taken. Due to time considerations, the chair, at his or her discretion, may limit each individual offering public comment to no more than 5 minutes. Because there's no physical location for this meeting, public testimony under this agenda item may be presented by phone, online via Microsoft Teams, or written comment. When providing public comment, please remember to unmute your microphone or telephone and begin by stating your name for the record. Those wishing to provide public comment by telephone, please dial 1-775-321-6111. And when prompted, enter the phone conference ID number 392-429-561#. Members of the public may also request comments be added to the minutes of the meeting by submitting them in writing, either in addition to testifying or in lieu of testifying. Written comments may also be submitted before, during, or after the meeting. All right, for possible action, review and possible approval of the meeting minutes from April 18th, 2024. Those meeting minutes have been sent out. Does the committee have a motion to approve those meeting minutes?
This is Rebecca Davis with the Radiation Control Program. I approve those minutes.
Thank you, Rebecca. Do I have a second?
Becca, only, Jeremy, it has to be a member on the committee that gives you the nomination in the second. And only you guys vote.
Oh. So I've got Afton,
This is
Rowena.
Tatiana. This is Tatiana
Tatiana.
Gesundheit. Yeah,
Okay.
I go ahead and approve.
Motion to approve. Can another member of the committee please second that?
Afton Heinzen, I second that approval.
Thank you, Ms. Afton. All right, so meeting minutes from last meeting have been approved.
No, you have a motion and you have a second. Now everybody, the 4 members have to vote.
Oh. All right, thank you for that. All right, we have a motion and a second. All in favor of approving these minutes, please make motion, please identify. I approve, Jeremy.
I approve
I
Afton.
approve. I approve Tatiana.
I approve Rowena.
Okay, of the 4 of the 6 members that are in attendance, all 4 have approved. And the meeting minutes are officially approved for the record. All right. Next item for possible action, the division requests recommendations regarding remote medical imaging. Remote medical imaging is when an operator controls the image acquisition from a physical location that is different from the patient. The American Society of Radiologic Technologists, or ASRT, issued a position statement on June 25, 2023, in opposition to remote medical imaging unless a radiological technologist is physically present with the patient when the procedure is being performed by a remote operator. The position statement may be accessed at said website on the agenda item. The ASRT also revised their practice standards for medical imaging and radiation therapy to support this position. You can see computed tomography, CT sections, and standards 1 through 4 and 9. The practice standards that can be accessed at the ASRT website. The link can be found on the agenda. For possible, okay, so that's where we're at. We also did receive, this is for members of our committee here. We did receive via email a memorandum from the Department of Health and Human Services. Would this be a good time to bring this up, Matt or John?
Yes.
Okay. The memorandum is dated May 15th, 2024 to John Pennell, Chair of the State Board of Health, from Cody Finney, Administrator with the Division of Public Health, regarding a variance case number 762 for MedSmart. Did all members of the committee, all 4 of you guys, the other 3 also receive this memorandum in your emails?
I received
Mrs.
it, but I cannot open it. I cannot see it. It won't download for me.
Okay, I can read it to you. Yes, here.
Thank you. Thank you, Jeremy.
Yeah, welcome. All right, so subject, case number 762, MedSmart, variance to Nevada Administrative Code, NAC 653.400, scope of practice for radiologist assistants and persons who hold licenses or limited licenses, section 653.400, subsection 1C. Staff review, for the reasons stated below and with the conditions specified, the Department of Public DPBH staff recommended the State Board of Health approve case number 762, MedSmart, requests for variance to NAC 653-400, subsection 1C. It states in relevant part, for the purpose of defining the scope of practice pursuant to paragraph B of subsection 1 of NRS 653.460, a person who holds a license to engage in radiological imaging issued pursuant to NRC 653.310 to 653.910 inclusive. Number 1, may, while under the supervision of a licensed practitioner, if applicable, use ionizing radiation for diagnostic purposes or to visualize a medical condition by applying the ionizing radiation emitted from X-ray machines to any part of the human body. Number 2, may, in conjunction with the study of radiation, administer contrast agents and related drugs for diagnostic purposes. Number 3, may perform diagnostic, radiographic, and non-interpretive fluoroscopic procedures as prescribed by a licensed practitioner, and may assist the licensed practitioner with fluoroscopic and specialized radiological procedures. Number 4, shall perform his or her duties in accordance with the standards of ethics adopted by reference in subsection 2 of NAC 653.090. So a summary of the variance request is this. Variance applicant MedSmart submitted a request for variance from the requirements of NAC 653.4001C on April 22nd, 2024. The applicant is requesting authorization to perform remote computed tomographic imaging. Remote CT is a new technology that allows an offsite technologist to remotely initiate CT imaging. The remote CT is accomplished by using visual and vocal communications between the CT technologist, patient, and an assisting person at the facility. Persons licensed to perform radiological imaging include radiologic technologists or RTs, radiation therapists, and nuclear medicine technologists. Throughout this memo, these persons will be referred to as RTs or assistant technologists. Persons licensed to perform CT have additional training and certification specific to CT. Throughout this memo, persons licensed to perform CT will be referred to as CT technologists or remote technologists. This variance proposes to use a CT technologist at the remote location and an RT as the assisting person at the site where the patient is being imaged. A variance is needed to expand the scope of practice for RTs in NAC 653.400 to include assisting with remote CT imaging. The intent of the regulation. NAC 653.400 subsection 1C defines the scope of practice for persons licensed to engage in radiologic imaging to ensure technologists have adequate training and qualifications to safely image patients and to protect themselves, other workers, and the public from radiation. Remote CT is a new technology which is not in use when NAC Chapter 653 was promulgated and therefore not included in the current regulations. The applicant is requesting a variance to include within the scope of practice for RTs the duties and tasks necessary to assist a CT technologist with remote imaging. The additional scope of practice for assisting with remote CT include those tasks that must be performed at the imaging site, including administering CT contrast, positioning the patient, operating the CT console under the direction of the remote CT technologist, responding to emergency situations, and ensuring the radiation safety of the patient and other workers. Licensed RTs already perform these duties for other modalities of radiologic imaging, but not for CT. CT has specific training requirements that are in addition to the training required for other radiation producing machines. To ensure the intent of the regulation is met, the assisting technologist will be trained to do the same standards as a certified CT technologist for the tasks they perform. The degree of risk to public health or safety is the next section. Not having a CT technologist at the site with the patient could result in excessive radiation exposure to a patient, other workers, and members of the public. and adequately trained persons who would not be available at the imaging site to handle emergencies should one arise during a CT imaging procedure. These risks can be mitigated by having at the imaging location a licensed RT who has additional training to competently assist with CT imaging in emergency situations. Some background information. The state licenses around 3,100 persons for radiological imaging, and of these, 723 persons are licensed to perform CT. The state is experiencing a shortage of imaging technologists across all modalities, but especially for CT and magnetic resonance imaging, or MRI. Remote CT imaging enables a CT technologist to provide services for multiple medical offices from a centralized location, thereby helping to provide CT imaging services to medical facilities who are unable to obtain the services of a CT technologist. Remote CT is a new technology that allows an off-site technologist to remotely initiate CT imaging. The remote CT is accomplished using visual and vocal communications between the CT technologist, patient, and an assisting person at the imaging facility. The program reviewed information on the Philips Radiological Command Center, or ROCC, provided by the applicant. The ROCC is a system that provides real-time virtual collaboration platform that connects the CT technologist at the remote location with the assisting technologists at imaging locations and other healthcare professionals such as radiologists, which may be at different locations. The platform is safe, secure, has multi-factor authentication, works with multiple brands of CT systems, and provides audit trails of all interactions. Making access to imaging results across more locations could help radiology departments and radiologists meet patient and workload demands. Collaboration among medical facilities also has the potential for increasing patient access to CT services. The system also has the ability to perform remote MRI. Nevada does not license or inspect MRI systems, but integration of CT with MRI into the same system may make MRI services more accessible to patients and add to the success of this technology. Persons licensed to perform radiological imaging must be certified by the American Registry of Radiologic Technologists, or ARRT, as a radiography technologist, RT, to perform CT imagings. RTs must complete additional training to become certified in CT. The variance proposes to use a CT technologist at the remote location and a RT technologist with additional training in CT as the assisting person at the site where the patient is being imaged. The variance is needed to expand the scope of practices for RTs in NAC 653.400 subsection 1C to include assisting with remote CT imaging. The ARRT has established structured educational and clinical experience requirements for CT certification, which includes a list of tasks that CT technologists perform. To ensure patients are imaged by qualified and competent persons, the assisting RT will be trained to the ARRT educational and clinical training requirements for CT technologists for the specific tasks they perform. The training will incorporate appropriate sections of the CT curriculum established by the American Society of Radiologic Technologists. The RT is not required to be trained on all aspects of CT, just the tasks they perform. The training can be developed and provided by the applicant, a contractor, consultant, manufacturer, or educational institution, provided the level of training is commensurate with the RT's duties and responsibilities. Persons licensed in nuclear medicine, technologist, radiation therapist, grandfathered CT technologist can also assist with remote CT provided they complete the license training described above. The applicant has agreed to develop, document, and maintain a radiation safety program to ensure the safe use of this new technology. The program elements of the radiation safety program are in attachment A. The applicant's commitment to develop, document, and maintain a radiation safety program is in attachment B. Approval of the variance with the above conditions will minimize the risks to public health and safety to the extent practical. Section is identified as exceptional and undue hardships. Strict application of 653.4001C requires the applicant to have a licensed CT technologist at each imaging site, which is restricting medical providers' ability to image and care for patients. The state has experienced a shortage of imaging technologists across all modalities, but especially for CT. The state licenses around 3,100 persons to perform radiological imaging, and of these, 723 are licensed to perform CT. The shortage of licensed CT technologists is affecting patients, medical care providers, and hospital emergency rooms. Patients who require a CT exam must schedule the CT exam weeks in advance or go to a hospital emergency room. This hinders a medical provider's ability to provide a patient care, increase the patient's cost for care, and places an additional burden on emergency rooms. Remote CT can help alleviate the impact of this shortage because it enables one CT technologist to provide services for multiple medical providers from a central location. Approval of this variance is not expected to adversely affect other persons subject to the regulations because DPBH would support variances from other registrants who would benefit from this technology under the same conditions. Section entitled Impairment to the Purpose of the Regulation. Approval of this variance will not impair the purpose of the regulation because a CT technologist at the remote location will be fully participating throughout the imaging processes throughout thorough vocal and visual communications, and the assisting RT will be trained to do the same level as the CT technologist for the specific tasks they perform at the imaging location. The applicant will develop, document, and maintain a radiation safety program specific to remote CT that includes adequate controls to ensure the safety of patients, other workers, and members of the public. Section entitled Staff Recommendation. DPBH staff have recommended the State Board of Health approve case number 999 MedSmart, a request for variance to NAC 653.400 subsection 1C for a period of 10 years with the condition that the applicant will implement the commitments in attachment B. Public comment section. Notice of the hearing is scheduled to be posted on the Division of Public and Behavioral Health website and at the 4150 Technology Way office in Carson City before 9 a.m. on May 23rd, 2024. The Division of Public and Behavioral Health is not aware of any objection to this variance. Many local authorities, no public comments have been received to date. Signed by the presenter, John Follett, Manager, Radiation Control Program, Division of Public and Behavioral Health, Bureau of Health Protection and Preparedness. Hang on one second. Okay. All right, thanks, guys. Had to grab a drink. All right, there are two attachments to this document. Attachment A is the radiation safety program elements for remote computed tomography, and attachment B is the applicant's commitments. For those of you who are unable to see this, I'll read attachment A, the radiation safety program elements for remote computed tomography. The applicant will develop, document, and maintain a radiation safety program with the following provisions. Use only remote CT systems and components that can adequately protect patient information and to establish policies and procedures for ensuring patient information is protected at the imaging facility, remote imaging locations, and locations where other members of the medical team will be viewing or accessing patient information. Remote CT systems or components must be approved by the Food and Drug Administration prior to use when approval is required by the FDA. Maintain a list of the remote locations and associated imaging sites. This list is to contain the name of the facility, location, and a contact person. The assisting technologist will be licensed to perform radiological imaging as radiological technologist, radiation therapist, nuclear medicine technologist, or to perform CT. The remote CT technologist must be licensed by the state of Nevada to perform the CT. Define the roles and responsibilities for the remote CT technologist and the assisting technologist. Identify the tasks performed by the assisting and remote technologists and develop procedures for these tasks. Train the assisting technologists to the ARRT educational and clinical training requirements for CT technologists for the specific tasks they perform. The training will incorporate appropriate sections of the CT curriculum established by the American Society of Radiologic Technologists. Ensure the assisting technologist completes annual radiation safety training related to their CT responsibilities. Ensure the assisting technologist maintains constant surveillance of the patient throughout the CT imaging procedure and performs only one CT imaging procedure at a time. Ensure remote CT will not be performed if communications, verbal and virtual, or connectivity between the remote site and the imaging facility is not functioning properly or is otherwise unreliable. Develop procedures for responding to emergency situations where there may be a loss of connectivity between the remote site and the imaging facility. Perform checks of the communication system, verbal and visual, and the functionality and connectivity between the remote location and the imaging facility prior to initiating each CT imaging procedure. Ensure the remote CT technologist maintains constant surveillance via local and visual communications throughout a CT imaging procedure and performs only one CT imaging procedure at a time. Ensure the CT technologists at the remote locations are licensed in the state of Nevada to perform CT. Follow all of the manufacturer's recommendations for service, testing, and maintaining both the CT and remote CT systems. Develop policies and procedures to ensure adequate management oversight of remote operations, including audits to evaluate the effectiveness and safety of the remote CT operations, observations of work being performed at both the imaging facility and the remote location, and processes to identify, track, investigate, and implement corrective actions for incidents where CT exams are incomplete or repeated. And that section, I'm looking at attachment A still. The next section is a copy of a letter before the State Board of Health in the matter of MedSmart variance request, case number 762. Just a response, it's the same letter that I read earlier. The board's response. I won't read that again. The last part of that letter has a section called Conclusions of Law. This matter is properly before the Nevada State Board of Health pursuant to Nevada Revised Statutes NRS 439.2.200, and determination of the matter on the merits is properly within the subject matter jurisdiction of the board. NRC 439.200 provides the State Board of Health may grant a variance from the requirements of a regulation if it finds that A, strict application of that regulation would result in exceptional and undue hardship to the person requesting the variance, and B, the variance, if granted, would not, 1, cause substantial detriment to the public welfare, or 2, impair substantially the purpose of the regulation. Number 3, the board finds that strict application of the regulation would result in an exceptional and undue hardship. Number 4, the board finds that granting this variance would not impair the purpose of the regulation or cause a substantial detriment to the public welfare. Concluding portion of that letter states, order based upon the foregoing findings of fact and conclusions of law and good cause appearing. Therefore, it is hereby ordered, adjudged, and decreed that the variance from NAC 653 subsection 1C is approved as presented. Specifically, MedSmart will be allowed to perform remote computer tomography CT for a period of 10 years after the date of this approval, provided MedSmart complies with the radiation protection commitments submitted in support of this variance. Dated the 7th day of June, 2024, signed Cody Finney, MPH Administrator, Division of Public and Behavioral Health, Department of Health and Human Services. Okay, that's the conclusion of the memorandum. Do any members of this committee have any questions or concerns regarding that memorandum that was just read?
This is Tatiana. No, I'm okay.
This is Afton
Okay.
Heinzen. Thank you for reading that. I'm good with all that was said.
Hi, this is Rowena Copeland.
Fantastic.
I've got questions
Rowena.
regarding a couple of things. The first has to do with state license. And I understand that they can, the person performing the CT must have a state license. The question I have, will that person be in state or out of state? Because my concern is they won't necessarily be in state, and then therefore we can't really monitor how many exams that individual is performing, because it sounds like from what they presented, CTs would be performed by several facilities, would be sending we're expecting exams to be performed by that remote CT tech, and how can we ensure that they are only performing one exam at a time? So, like I said, will the person be in state or out of state? And how can we ensure that they will be performing one exam at a time?
This is
Those are
Rodney
good
Smith.
questions. Go ahead, Robbie.
This is Rodney Smith with MedSmart. The main hub of the remote is located in Nevada. It is in Las Vegas or Henderson area, right off St. Rose. And we're building a system so we can document times and events that happened during that time. So you could see, track our systems so you can clearly see we're only doing one at a time.
MedSmart has oversees outpatient facilities and hospitals. So my concern also is about how to make sure that you do not use this remote for hospitals, because if a patient comes in for a stroke and there's an issue, then you're running into a delay. Um, as far as if there's an issue with the visual, or what was the other communication? I can't remember what it said.
Verbal and
Verbal.
virtual.
Yes.
Okay. So is this going to be strictly for outpatient facilities, or are you going to try to do this in some of the hospitals also?
Okay.
The-
Rodney,
Sorry, go
can I speak for just a moment? This is John
Absolutely.
Follett. Rowena, this does not limit the remote tech from being out of state. We spoke with our legal counsel, and remote CT is not limited to someone in the state.
That's a concern then. Because just in case you're having somebody in Brazil or somewhere performing these studies, I understand you're saying that they're have a Nevada license, but I'm concerned about that.
So my question for you, maybe Rowena, if they were, because the proposal is that a licensed RT be on site, the remote technologist, and this is just so I can help understand where you're coming from. The remote technologist, they physically wouldn't be able to do anything more than what they can verbally, regardless of whether they're down the street in Arizona or in Brazil. How would you feel that that would be a concern if they were not in locally in Las Vegas or in Nevada?
Well,
Just
they
curious.
talked about the reason for doing this is to not delay care. Well, the tech that
Okay.
is sitting at the facility, if there is something that goes wrong, the tech at the facility can't perform the exam because they're not a CT tech. Whereas if the remote tech, if let's say they were in the Las Vegas area, then they could pretty much go to that facility and perform that exam at that time, thereby preventing any type of major delay in patient care. So having somebody out of state um, doesn't allow for that.
My understanding, and Mr. Smith, you can correct me, but if an individual is acting as the remote CT technologist and an issue comes up, and under your commitments here, you guys have to perform or have a policy in place on what to do. But I assume if something were to happen like that, you just would not perform the CT image, the procedure at all,
Correct.
or have
If-
proper medical personnel on hand.
Yeah, correct.
Just
And
not
then,
perform the CT.
and the personnel on hand, and in some of the hospital locations, it would be a secondary, we have 2 to 3 scanners per locations. So we'd be a secondary to the CT tech that is there already.
So
So
if
you're
you have,
talking
let's
about
say,
at a hospital, but not at an outpatient facility.
Outpatient facilities will have X-ray techs, a registered RT, who, can administer radiation, and then, the actual scan would not be completed remotely if the communication was interrupted for a reason.
I'm concerned about that. The other thing is I'm concerned about the variance undermining the Nevada state license with regards to the individual who has been approved for a CT license. In that, if this is allowed, then somebody could one day come back and say, now you don't even need a CT license. You just need this special training, almost like a limited license to perform CT exams. And I'm concerned about that.
Are you concerned about the direction that it may be heading if this
It may be
proceeds?
heading, yes.
Currently, the way the variance stands is that the licensed CT technologist is involved in each and every case, just not physically involved with the patient interaction and setting it up. But you are concerned for future that this could lead into other things later.
Correct.
This is John Follett. For CT to take place, they have to have a radiological technologist that has a license for CT. Period.
That's according to Nevada State right now, yes, but the person
Correct.
who is going to be at this facility positioning the patient does not have to have a CT license. And so my concern is that over a period of time, if this is allowed, then there will come a point where they will say, you don't even need a CT license because we've got data to show that it was not necessary. And so I'm concerned about that.
This is John Follett. That would the regulations would have to change in order for that to occur.
But I think with this variance, that just opens the door for the regulation to change.
Hi, this is Afton Heinzen. The way I understand it is, yes, you have to be an X-ray tech, so registered technologist. And back in the day, these people would just get cross-trained to run CT scanners. So that's kind of where I see it going. And if they are cross-trained and they do X amount of exam and X amount of hours, then they can take the state board license to then become CT technologists. Is this correct?
It is, but that's not what they're talking about doing, is implementing some type of cross-training program. They're talking about pretty much just having an X-ray tech who has been given some brief direction on how to position a patient for a particular exam. And then, but they're not performing the exam, because in order to get the state license, you have to perform a certain number, not state license. And that in order to sit for the advanced registry, you have to have performed a set number of exams. My concern is that this variance would just open the door for it to bypass our state license and undermine it to allow for there not to be the need to have an advanced registry to perform CTs.
This is Rodney Smith. We're not, and I am a state licensed and certified CT X-ray technologist. We're not trying to change the statutes that state who can do the exams. And the locations, we're stating that an RT has to be available to help. Everything's done remotely by a licensed CT technologist.
Yeah, but in your standard, you said they have to receive additional training to perform these tasks. Hold on, let me see where it says that.
And we're just talking
Which
about the
is almost
training.
like a limited license. It almost sounds like you would need to set up a limited license for this particular individual. Because my concern is And I know MedSmart is a staffing agency also, that you would have several different people on different days coming into a facility who may not necessarily have the credentials of having completed this training. And so, like I said, I've got a lot of concerns about this, and I would vote against this variance being allowed.
Yeah,
Th-
Rodney
This
Smith
is,
again. Sorry,
good.
go ahead.
This is John Follett. Rowena, this variance is already approved and in effect.
Who approved it?
State
I
Board of
mean,
Health.
so then why are we here?
The program has asked for the advisory committee to make recommendations when it was, and so we are looking for recommendations on this, in particular, if there are regulation revisions, and we were asking for what the committee would, what recommendations the committee would make for remote CT imaging. That's what the program was asking for.
This is Jeremy Mangum again. So based on attachment A of that letter from the approval letter, there's a list of requirements or expectations for MedSmart and in the future, any other company that would probably follow the same guidelines. This list of expectations or commitments to follow are pretty thorough from what I read. And yes, it will require effort, especially on the part of MedSmart, to create, as Mr. Smith noted, whether it be a software or a program to follow and track the time, the communication, the events that occur during these procedures. I think it's personally, I think it's pretty thorough as far as defining what needs to happen, and the board can review. It's, it's a limited license for up to 10 years, or approval for 10 years. And as we go through, as they can be audited by the state or whatnot, they can see if there are any future issues that may arise. Me personally, I feel that this is a very thorough list of expectations for the company. And as long as they meet those, I think there shouldn't, my opinion is there shouldn't need to be much in the way of changes at any means. But as we audit and inspect over the years, changes may come up as we learn more about how the process works. Those are my
How
thoughts.
often would they be audited?
Maybe that's something we can suggest as a committee.
Okay.
What do you think, Rowena?
I think quarterly.
Inspected
Mr. Follett?
quarterly?
Yeah.
The
Mr.
inspection
Follett, how
frequency
would an
would
audit?
be probably 3 years, every 3 years. Does that sound right, Matt, for the type of facility?
I don't agree with that.
Well, CTs are on an annual review as far as the machine is concerned. We could add that to the annual review to these specific facilities, if that would work.
I'll agree with
I
a
think
yearly.
so, Mr. Follett, I think that what she's recommending is, because it is such a newer program, rather than fall directly under the existing 3-year inspection or annual X-ray inspection, that at least annually, specific to this type of procedure, that they be audited and reviewed, just to make sure it's functioning like they have committed to,
Supposed to.
and
Mhm.
moving forward. Does that sound right, Rowena? Am I interpreting your suggestion correctly?
Yes. Yes.
Okay. Is that something
Listen.
that the state can do? Oh, Rodney,
Uh,
go ahead.
This is Rodney Smith. I'm in agreement with the annual. I'd be more than happy to provide any information needed annually.
Go ahead, John. You were going to say something.
Yeah. This is John Follett. An annual inspection is the highest frequency that we have for an inspection.
This is Jeremy. Is that something that we can do or approve as far as the state level goes, just because it is such a new program to verify that it's functioning well? And I think it will better satisfy other companies want to do this in the future. We'll have a running idea of how well it's working by doing this.
Mhm.
Okay. Those are some of the recommendations that you as the advisory committee can write up and then provide to the program.
Okay. I think that's a recommendation we can provide, Rowena. I'll agree with you. And Mr.
Okay.
Smith seems to understand that too. Tatiana or Afton, is there anything else that you'd like to recommend?
No, this is Tatiana. I am for at least having that yearly checkup, and I know I'm actually very good with everything that is transpired. I'm okay. Thank you.
Miss Afton, do you have anything that you'd like to recommend?
Yeah, this is Afton Heinzen. I'm just pleased to hear that there will be a licensed tech kind of overseeing it all. Would it be too much to ask, because it is so new, to do a 6-month? And then if that's good, then we can go yearly,
Yeah.
just to see how it's going and to make sure everyone's documenting the proper things. And if not, then we can make, some recommendations on that end.
That's definitely something we can write up and recommend for sure. Thank you for that suggestion.
Yeah, and I'm just hoping this motivates people to want to get cross-trained and then eventually get licensed as a CT tech. I think it's opening a door, so I'm for it.
It'll only be opening the door if that individual at that facility is scanning the patient. Otherwise, it's not.
This
Because
is
like I
Tatiana.
said, the person who is, in order to get that license, the advanced registry, you have to have performed a certain number of exams. And so the
Correct.
person who is at that facility, who is positioning the patient, is not performing the exam, i.e. will not be able to then sit for the registry.
Yes, I'm just hoping it
Rowena,
motivates them to take the other steps.
Rowena, this is Tatiana.
Uh-huh.
I wanted to remind you that the person that is going to be assisting is already another tech. It will be a nuclear medicine tech or an X-ray tech, both of them with bachelors. And I believe what was the other, Jeremy, was radiation therapy,
They
which
might
I'm
have to
sure.
have an AR registered tech doesn't necessarily have a bachelor's.
Well, but we all have ART. We're
Correct.
all registered techs. So it's
Correct.
not that you're just getting like a transporter or somebody off the street to do it. You already have techs that are working in their own modalities as techs, and they have performed thousands of exams under their own modalities and know how to position a patient on the camera and take them off. I mean, because that's what my understanding, that's what we're going to be assisting with. So I don't feel that there's much to fear in that respect. In addition to that, I mean, we all have dealt with emergencies with patients in our own modalities. So we're just, and in some cases, in some hospitals, we even help each other among modalities. So we're already sort of cross-trained. So I don't see, but I do see, I do see I would be more concerned actually in an outpatient setting than in a hospital setting. I do see how you can be concerned, but just keep in mind, we're already all registered techs that all deal with our own patients in our own modalities. So positioning a patient for CT with some extra training that MedSmart is willing to come up with, I don't believe that's going to be a problem. That's just my opinion as a tech.
Well, like I said, my concern is that it not only is a problem, but that it then opens up the door for there not to be a need to have in our state license, the need for special training or advanced registry certification. And so it just opens up the door to change that whole process that we currently have. So that's my other concern. But the other thing that I asked was about remote locations, where the tech will be located. So you're saying the tech can be in state and out of state?
This is John Follett. Yes, this is going to follow the same type of rules and regulations that telemedicine is following.
Who is
There's
telemedicine?
Telemedicine is allowed, and those same kind of rules
Oh,
are going to be applied
telemedicine.
to this.
Okay.
Okay, this is
Um,
Jeremy again. Did you have any other comments or questions, Rowena?
No, I just think we need to, like she said, this 6 months to start, and then maybe a yearly review of their processes, and to make sure they're following the rules. So this has already been implemented. It doesn't
Yeah,
make
it's already been approved. It's already been approved. So our job is to help make sure that we can add any other recommendations. And I think you guys have offered good advice, a 6-month review, because this is such a new program, and then annual thereafter if it's running smoothly. And that will allow us to, or the facility, the company MedSmart, to be evaluated and make sure they're compliant with their commitments as well. And if everything continues to run smooth, then it could potentially make it possible for other companies to do this. And like Ms. Afton said, also to help provide incentive maybe for some of these RTs to officially cross-train in other ways to become licensed in CT or any other modality as they choose. But definitely we understand that these are licensed RTs that are assisting a licensed CT technologist working remotely. And so our recommendation that we have right now is to the state is to offer a 6-month initial review or audit, and then annual thereafter if everything is running smoothly. And we can make that suggestion in writing to the state for sure. Any other suggestions that you guys might want to suggest to the state?
Well, let me ask you this.
Before we
So
hit-
MedSmart, this is mainly with MedSmart. So Deseret, Steinberg, and other facilities, other radiology facilities,
Yeah.
cannot perform this at this time? This will only be open to MedSmart?
Well, currently in the state of Nevada, and Mr. Follett, you can correct me if I'm wrong, that only MedSmart has applied for this opportunity, correct?
Correct. What the program plans to do is to revise the Nevada Administrative Code 653 to add remote CT to the regulations, to include that within the scope of practice for someone who has an RT license. And to follow up on what Tatiana said, there are other states do allow RTs, people with the ART, to perform CT. They don't have a special group that is special for CTs. So this is consistent with what some other states do as well. But
That's not our state
when
license, but that's not our
when
state license. So that's why I'm concerned.
so when the Nevada revised statutes require a CT license. You have to
Correct.
be licensed in CT to perform it in the state. The NRSs can only be changed, but it has to go to the legislature to have those changes. We're talking about revising the Nevada administrative codes, the regulations that are approved by the Board of Health. And we are going to plan to include within the scope of the RT licenses for them to be allowed to assist with remote CT. But in all cases, a CT tech will have to be the person involved with the CT. So we're kind of requesting, do you guys have any recommendations for us as we revise these regulations? And any other recommendations that you want to make?
For me, I'm gonna say not at this time because I really need to look at this. And what was what's the regulation, the Nevada statute that you're talking about changing? I didn't write it down.
Nevada Administrative Code, NAC 653. And it's listed in the variance. And so, you guys can form a working group and then, develop recommendations and then submit it to the program.
This
If
is
you want
Jeremy
to,
Mangum. I think that's what we can do is we can communicate via email and see if there's any more suggestions beyond what we've already talked about and submit that in writing to the state moving forward.
Yeah, I agree with that. Just a committee. Just a committee member. How many are we? 6? 6 committee members,
Yes,
right?
Yes.
Okay, probably we need to just start a like a group chat or something like that so that we can answer each other's questions and concerns.
Okay.
I would be willing to. I think I have everybody's phone numbers. I don't know if you would rather do it by email or we can do it as a group chat. I don't know, what would you like? But I can start that.
Okay.
Let's start with text and we can discuss it as we go.
Okay.
As for the meeting itself goes, I don't think there's anything else to address regarding this issue at this time. So I'm sorry, what was that? Nothing. Okay. All right. So this is item number 4 on our agenda, has been pretty thoroughly discussed today, and we look forward to seeing how this turns out for everybody so that the Board of Health can make maybe some more permanent modifications to NAC to help with staffing and safety issues moving forward in the future. The next item on our agenda for possible action, number 5, is discussion of possible action to select the next meeting date of this committee. Suggestions are Thursday, November 14th, December 5th, December 11th. Do the members of this committee, Rowena, Afton, and Tatiana, have any preference on any of those 3 dates, November 14th, December 5th, or December 11th?
Can we do December 5th if everybody's okay with that?
I'm not available that day. I'm gonna be on a flight.
The 14th then?
Yeah, the 14th.
This is
14th
Afton
December
November.
14th?
Heinzen. I have an 11:30 appointment on the 14th. That's 2 hours. Would it be possible to do 1:30 or is that a stretch? Or we could do earlier.
No, I cannot do it earlier.
Okay.
Afternoons work better for me.
Either time is better. It's fine with me.
Okay. Should we do 2 just to play it safe to make sure I'm out of that meeting?
Well, December 14th is a Saturday?
Oh, no, we're
No,
talking
no,
about
no.
November.
Oh, okay. Yeah, that's fine.
Matt or Mr. Follett, is there any issues with changing the time? I know you have the time in the agenda, 12:30 to 1:30, but can that time be adjusted as well?
yes. This is John. Yes, you can schedule the meeting whenever you like.
Okay.
This is Afton Heinzen. Would, just a month follow-up be better since we need to form this work group and bring some information to get this all underway?
Well, remember, we
Well,
have posting requirements as well.
Oh, got it. Okay.
Yeah,
So November 14th.
November 14th at 2 p.m.
Perfect.
Yeah, 2 p.m. is fine.
Yeah.
Yeah,
Okay,
that'll
this
work.
is,
So,
this is Bill Gorman. I'll send out a meeting maker for November 14th at 2 p.m.
All right.
Okay.
Thank you, everyone.
thank you, Bill. Okay, so number 6, public comment. No action may be taken on a matter raised under this item of agenda until the matter itself has been included specifically on the agenda. Mr. Follett or Matt, just verifying, is that all that needs to be addressed in this meeting?
Yes, I believe so. John?
Yes, just, you can ask if there's any public comment.
Okay, anybody else on the call? There's several people here. Is there any other public comment, persons that would like to make comment regarding the issues we discussed on the agenda?
This is Rodney Smith. I'd just like to say I appreciate you guys' time. Thank you.
Thank you, Mr. Smith, for your input as well. Appreciate it. Well, if there's nobody else to make public comment regarding this issue, then we move to adjourn this meeting at this time. Anybody second the adjournment?
Second.
Mrs. Afton, I second.
All right. That being said, we'd like to close this meeting of the committee, the Radiation Therapy and Radiologic Imaging Advisory Committee for Thursday, September 19th, and look forward to our follow-up meeting on Thursday, November 14th at 2:00 p.m. Thank you, everybody, for being in attendance. Have a wonderful day.
Thank you.
Thank you, Jeremy.
Thank you,
Thank you.
Jeremy.
Have a good day.
Have a good night.
Bye.
Bye.